Did you know that some diseases can be suspected by smell? A pungent body odor is usually considered a sign of poor hygiene. And sometimes it really is. But what if it can tell you about the processes going on inside your body? In this video, we will share some really important information that can help not only you, but also your loved ones. Watch this video to the end so you know when you can't ignore a change in body odor. What does smell tell you? Surely you are used to the fact that all your acquaintances have their own special body odor. Sometimes even the first time you meet a person you want to stop communicating with him because we don't like his smell at all, and sometimes someone from the first seconds causes sympathy. This specific body odor practically does not change throughout the whole life. It may intensify during sports or in the heat when we are actively sweating, or it may decrease after showering when all the sweat and sebum from the body is washed off. But it doesn't go away completely. Some people are used to masking it behind perfumes or deodorants and completely forget how they actually smell. There's nothing wrong with that. If everyone abruptly stopped using colognes and perfumes, it would be impossible to breathe on buses in the summer because of the mixture of smells. However, this sign can tell us a lot about our body and can even be the first signal of disease. If the usual smell has suddenly changed dramatically, it indicates a change in the chemical composition of the body itself. Such signals should not be ignored. After watching this video, you will know what the changed body odor says. Smells of disease. The first smell is sour. It does not always indicate any disease, perhaps you just ate too much spicy food or overdid it with spices or garlic. But sometimes it could be a sign of thyrotoxicosis, increased synthesis of thyroid hormones, because of which the sweat glands begin to secrete a lot of sweat. And if you have also suddenly gained weight, or feel that your mood changes too often, then this is a reason to see an endocrinologist. The second odor is the smell of urine. A specific odor that appears due to impurities of ammonia in the sweat. Such changes occur as a result of kidney or liver disease. If these two organs do not work properly, then the body begins to release toxins in other ways, for example, through sweat. And if ammonia begins to smell in the mouth, it could mean infection with the bacterium Helicobacter pylori, which causes stomach ulcers. If this smell occurs, a nephrologist can help check the kidneys, and a gastroenterologist or hepatologist can check the stomach and liver. The third odor is a vinegar odor. This is the smell of acetone, which is released through sweat due to the large breakdown of fats in the body. If a person has always been overweight, and then he suddenly decides to lose weight and starts exercising, then the body just cannot so quickly remove all the acetone formed through the kidneys. And it starts to be excreted through sweat. This smell can also be caused by diabetes mellitus. Because the pancreas doesn't produce insulin, the brain doesn't have enough glucose and sends signals to break down fats. Diabetes mellitus can also smell sweet or citrus, pineapple, or stale apples. This is due to the excretion with sweat and urine of not only acetone, but also glucose. Its amount varies throughout the day, so the strength and character of the odor will also change. One of the most common age-related diseases, Alzheimer's and Parkinson's, scientists claim can also have its own specific smell. Because of changes in body chemistry, Alzheimer's can smell like rye bread or yeast, and Parkinson's can smell like musk. Many bacteria and fungi accumulate in the skin fat, and it is these that give the skin its pungent smell. Another odor is a honey odor. This odor is often compared to the smell of Pseudomonas bacillus. This pleasant scent should not mislead you, because it is a rather dangerous bacteria that can cause meningitis, sinusitis, otitis media, abscesses, and pneumonia. And those strains that have survived in a hospital setting often have resistance to many antibiotics. This means they cannot be killed with these drugs, so treatment will be long and difficult. The smell of fish is an odor that is difficult to confuse with any other. Sometimes it comes from a rare genetic disorder, trimethylomenuria. But more often it is caused by a bacterial infection in the vagina. The bacteria that cause this odor are normally present on the genitals, but due to lowered immunity or an acid-base imbalance, they can increase their activity and cause the odor to appear. And our last smell is that of sourdough. It is a manifestation of Norwegian scabies, a serious disease that occurs against a background of reduced immunity or senile dementia. It is caused by the scabies mite, which is also responsible for common scabies. Although more often it does not pass in such a severe form, it is worth paying more attention to this smell. So, pay attention to these suspicious symptoms. Have you encountered people with unusual smells? Share your observations in the comments.